Hello, good morning. I'm very excited that we are having this Matilda and collaboration with Urban Hatch going live today. And I'm just waiting. My name is Seng, and I'm one of the midwives at Matilda. I'm just going to give a couple minutes for people to trickle in and join us today. And I would like to also introduce, and it's our privilege to have the founder of Urban Hatch to be here with us today. And her name is Sofie. Sofie, would you like to introduce yourself?
Yeah, we might as well have a little chat while we're waiting for people to join. If there's anyone in the Facebook Live already, a big warm welcome and thank you for joining early. So as Seng said, my name is Sofie Jacobs. I am the founder at Urban Hatch. I'm also a qualified and experienced midwife. And I'm super excited to be here today with Seng because we're going to have a chat about the 4 things that every expectant parent should know. So we're not going to go into it quite yet because we do want to have a few more people join us. Now, I don't have any visibility on how many people are in, Seng, so I'm going to have to go with your cue on this.
Okay. So far we have a couple that's joining us now, so that's great. And we'll keep today's...
So for everyone's...
We'll keep
sorry,
today's...
go ahead.
Sorry. We'll keep today's tips simple and short. Deliver right to the point.
With the emphasis on deliver.
Yes.
As to midwives, right?
Yes.
Also, just for everyone's clarity, Seng is obviously based at Matilda Hospital. I am based in Hong Kong as well. So we're both dealing with slightly moody weather today. And at the start, we were both saying how it's affecting our hairstyles.
Yes. You had to give that away, huh? But at the peak here at Matilda, one minute we'll have cloudy, the next minute we'll have clear sky. So if you're ever at Matilda, you will certainly enjoy this view.
Exactly, and for those of you who will be giving birth at Matilda, the weather actually can reflect the roller coaster of labor and birthing, right? Which is quite a beautiful, comparison.
Yes. Spoken like a very well experienced midwife. Would you like to share a little bit more about your experience, Sofie?
Yeah, so I qualified as a midwife in Belgium in 1998.
Giving away your day already? Can't tell.
Giving away my age. So it's been 25 years now of taking care of expectant and new parents. So I delivered babies in Belgium, in the UK, in hospitals, midwife-led birthing centers, and did a fair amount of home births as well. And then I felt that there were just too many people that I came across who had no mental and physical preparation for their birthing experience, and especially for that postnatal period. So I then moved into focusing on education and set up a number of antenatal classes and postnatal classes all over London. And then when I moved to Hong Kong, I took that a little step further and, didn't deliver babies anymore, but really started to focus on that coaching and counseling aspect, not just for the women who were going through that physical and emotional journey, but also for their partners who may not be experiencing anything physically, but definitely mentally and emotionally. So then in 2017, I felt that people's attention span became shorter and shorter. Yes. And I wanted to come up with a modern solution to that educational aspect, and I created Hatch, which is a digital childbirth education course. And the collaboration that we're going to bring in today is Hatch at Matilda. You know, we've collaborated with you on creating a beautiful digital childbirth education course that is about giving birth, about the early days with baby. We're bringing in lots of things on partner support as well. and it is customized so that it fits in with the spirit of Matilda. So it's quite a unique product, and I am very excited about it and super excited about being here with you as well. And today is really about advice, right? We are going to give people 4 things that every expectant parent should know. And Seng, maybe for everyone as well, what is your experience? Why are you here today?
I'm actually very, very privileged to work with you today, and having known you have so many years experience, and I looked through Urban Hatch's platform for us, the antenatal classes. I really think that you delivered it very chic, simple, and very personable to each couple and partner, because a lot of it's very real to them. You have also a lot of couple interviews where people can relate to and bring it more personable. And with your years of experience and the ins and outs, rather than people, modern ladies and couples really get nervous nowadays about it, and yet their time is so short. Nobody has the time to read through a very thick book about birth and labor and all I really think your antenatal classes keep it nice and simple, and hence we are very privileged to work with you. And thank you for catering to our Matilda's platform as well, and what we can offer. And yes, the 4 tips, not to give it away any further, but those are very key, important things that we really would like all expectant parents to go home with, and we'll keep you hanging for a little longer. And with my experience, I have over 10 years experience being a nurse, and I chose midwifery for the bigger dream that I would like to do abroad one day, to care for more, to help more mothers and children in need. And I worked in the public hospital in Hong Kong, and now I am privileged to work at Matilda, where I truly feel the culture is very diverse and suits my background as well. I'm born in Macau, raised in the States, New York, and travel quite a bit. So I've seen things like you. I do enjoy the international client base we have here, and I enjoy the culture. Being a lactation consultant, I really see how like you said, it's not just about the birth experience. Having a baby, birth is just one day, but nonetheless is very important. It might seem hard to get through that one day, but it's definitely possible. And you'll definitely feel the positivity of Matilda, which will help you get through it. And then afterwards, the postpartum part, where Hatch also had a great platform to inform the parents in advance how it might be. So I really like that about it. And then give them an outlook, and then we will help them in person here at Matilda with lots of lactation consultants at Matilda. And how are we now with the trickling of people? We have a lot of likes, I see. That's great. Oh, we have about 30 people. That's great. Great start.
Fantastic. What do you think? Shall we get started, Seng?
Yes, why don't we?
Fantastic. So maybe just, we'll just have to backtrack a little bit maybe and do a very quick mini introduction again, just for those people who just joined. So a big warm welcome everybody to today's Facebook Live, which is facilitated by midwife Seng, based at Matilda, and myself, Sofie Jacobs. I am the founder at Urban Hatch. I'm also a qualified and experienced midwife, and I am basically the brain behind Hatch at Matilda, which is a customized digital childbirth education course that we have co-created with Matilda, and we're very excited about that. Now, today is not really about me, it is about giving you 4 tips that every expectant parent should know. But before we dive in, midwife Seng, can you just briefly, quickly introduce yourself again as well?
Yes, thank you. Hello, my name is Sing Wong. I'm a mother and a midwife at Matilda. At Matilda International Hospital, our group of dedicated staffs serves our diverse clientele professionally and efficiently. At maternity, which is our center of excellence of Matilda, you'll be greeted and receive a continuity of service from a midwife that follows you from antenatal delivery to postnatal. And not only are staffs well experienced, many like myself are lactation consultants, so your preferences for birth will be respected, and you'll be empowered with the skills that you need to best care for your new family. Without further ado, let's go ahead, jumpstart with our advice of 4 tips that we've been trying to hint, right?
Yes, so what are the 4 things that every expectant parent should know? So midwife Seng and I work together on this, and the first point that we want to get across is that preparing for birth and welcoming your baby into your life should just not be about that one-day event when you're at Matilda Hospital, but also the phase that comes afterwards. It's one of the big reasons why I created Hatch, and that was to get people to shift their focus from just preparing for that birth experience to preparing for the whole thing. And it's actually a little bit like how we would want people to approach preparing for a marriage, right? There is so much focus on preparing for the actual wedding day. People forget about the marriage, and then we end up with a very high divorce rate because of A, B, and C. So what we want to do when expectant couples prepare for their experience to include obviously the preparing for birth, but also the preparation for postpartum. And Seng, would love to get your thoughts on this as well.
I totally agree with you. We're on the same board, and that's why Matilda constantly work with great partners like Urban Hatch to provide the most comprehensive care starting early on in a pregnancy to help the couples better plan and better prepare for this birth experience and also welcoming their new baby into this world. And again, I really agree with you. One of the things we're talking about is communication, and with good communication, with good foundation set out beforehand, many of our clients are return clients, and we have a memory wall of fame, so say, from mothers and babies throughout the years. And I think last time when you visited, you have seen that wall.
I have, and I think it's wonderful. And actually, as you mentioned, Seng, in the introduction, Hatch at Matilda, our collaborative effort to get digital childbirth education out there, we do interview real couples. Yes. We do interview real people in that course, and the majority of them actually gave birth at Matilda Hospital. So for any one of you who will end up subscribing to Hatch at Matilda, you will get to know real couples that have given birth at Matilda, and you will get a little bit of a taste of what their experience was like so that you can better prepare for yours. And that gets us a little bit to the next point. So the first point was prepare not just for the day, but also for that postpartum period. And then the second point we would like to raise is the importance of thinking about a birth plan not as a plan, but thinking more of it as a birth preferences list, a birth wish list, and in midwife Seng's words, a birth proposal. And I think this is really powerful because I've delivered hundreds and hundreds of babies in all different types of communities, different types of scenarios. And if there's one thing I know is that the only guarantee that you get is that you're going to have a baby. Mm-hmm. We don't know how, we don't know exactly when, yes. Unless you've got a scheduled cesarean section. But even then, yes. We never have that 100% guarantee. And I think people like us right now today, we're so used to being in control of A, yes. B, C, and D. And we plan for the nursery. We've got our list of things to buy. We cross those things off the list. And then we think that we can also write a birth plan, and that then our birth experience just happens according to plan. And we would like every one of you who are listening today and your friends, so spread the word, we would like you to move away from the birth plan and approach it with more of a growth mindset and an open mind, and approach it as you would approach your birth wish list or your Christmas wish list, and you kind of write down your preferences. And you think with your midwife at Matilda about the preferences that you would like to include in there. And, I actually love that you call it, proposal, Seng, and maybe you can share a little bit, maybe you've got a few examples that you can bring in.
Sure do. And I, just to piggyback off of you, I like how we are, as midwives, we're always there and along the way with the couple, and we always have to stay up to date. And with the Urban Hatch at Matilda, the platform is so up to date and genuine that when the birth proposal or the wish list that we have there, you go into further explanations what they are. And we would like for the clients and the couple to talk it out beforehand. That's why it's introduced, so important to introduce it early on, so that you can have the time to think about it and talk about it out loud. Sometimes I have to say, ladies just like to keep everything inside, and this is not that time, because a lot of things can go down on that birthday, and it gives you a big idea, a big picture of what the birth process and the process after, how you would like to welcome that baby. And it is also a very important tool of communication between the couples and among all the parties that will be involved in your care. Don't you agree, Sofie?
I completely agree, Seng, and I think that you made a really important point. It's not just a tool for the birthing mother to think about what she would like. It's an important tool to get the partner involved. And that actually brings us to point number 3.
Yes.
We want you to include your partner. And partner could mean your life partner, it could mean your birth partner, possibly your life partner is going to be your birth partner or not, but you want to get them involved in, being on board with your birth preferences. And if there is anything in your birth preferences that you need your kind of partner's consent for, so for example, cutting the umbilical cord, we often see this as a point that is included into the birth proposal or the birth wish list or the birth preferences list, but there never was a discussion with the partner about this, whether they actually would like to cut the umbilical cord. So, not everybody feels comfortable doing that. So it could be, like Midwife Seng said, a beautiful tool, a beautiful starting point for you to actually communicate with your partner and get a dialogue going. And then for them also to be able to advocate for you when you're at Matilda. And I know from having taken care of lots of, Matilda clients, you're in a good spot. You're in a good spot at Matilda for you to have a discussion with your midwife and your doctor, and to kind of see what can be done to ensure that that birth preferences list is as well respected as it can be. So do include your partner. I know, Midwife Seng, that you have got a few kind of tips and tools and strategies that you use when you're taking care of a couple in labor. I would love to hear.
And just to bring this further home with the importance of communication and the birth proposition per se, be ready to be flexible with it and stay up to date. Despite that you might have come up with the written plan or a game plan for your big day, we will still, as a midwife, I will go through it with you one more time at Matilda, and I'm okay, and all the midwives are ready to be with you when you change and talk to us about your preference, what you would like to do. And sometimes when you speak out loud, you'll better understand yourself. And then also for I can't stress the importance of more, we are your advocators, and your partner, whoever that may be, exactly, like Sofie said, can advocate for you as well. Let me jumpstart with some examples. For example, many mothers would only like to give the best to their babies and to herself during this labor experience. Started out with natural delivery and wanting non-pharmacological, meaning no medication. Let me do with what Sofie has introduced in the Urban Hatch, some of the birth balls, deep breathing, mindfulness, massage, bath in the water. All these are offered. However, when the pain has caught up to you, it is okay to admit that I would like to need a little help, and the epidural or breathing of the gas. Empathony is also offered, and have your partner be with you is one of the key values that we value at Matilda. Is we're working together, and your partner will be with you at all times, and they will be able to witness. We're not trying to hide anything, so we will all be with you at that time, and things will be told to you as they are being done, so that you alleviate the scare and the frightenness sometimes may come with these procedures, despite you might already know because you've been introduced and well educated at Urban Hatch platform what they are. So again, we're very flexible to change. We're with you all the way, and the couple's involvement is start from the door that we greeted you, to the labor experience, to exactly like Sofie has explained. We respect the partner's wish to cut cord, cheer you on during the birth, and even doing the skin to skin, and then accompanying you through the baby care, doing the bath time with you. That's why at Matilda, we make the privilege for the clients to also include the father and their availability. Not just when the mom is available, but when the dad is available, to be there to also witness and go through this birth experience with you together.
Yeah, which is, gosh, Seng, isn't it beautiful how times have changed? Because if we were doing this, well, we wouldn't be doing this in the 70s because there was no internet yet.
Yes.
But back in the day, partners were not allowed, right? If anyone watches Call the Midwife, which is a beautiful series on the BBC, started in the 50s and then it moves through to the 60s, etc. And partners were shunned out
at the
of
door,
the,
right?
Labor room, yes, yeah, and they would go to the pub, to have a drink. So what we now want to do is include partners, and I think what you're doing at Matilda is wonderful because, like you said, it's from the moment that you enter the door until you go home with your baby, and even beyond, because the advice doesn't stop there.
Yes.
Partners will feel included and heard and seen and listened to. And as Midwife Seng said, we at Hatch at Matilda what we've done is we've actually created videos that are specifically designed for partners, because some of the education pieces speak to both parties in the couple, right? Yes. But some really need to be done separately for partners. We need partners to know that they're going to feel overwhelmed at times. They may feel a little bit helpless at times, but then these are some of the strategies that they can adopt to make themselves feel less helpless. And these are the strategies that they can adopt to accept that this process is going to be a new process, and a new process brings about new emotions and new experiences. So all the way through Hatch, we've got 7 modules in Hatch at Matilda. Yeah. And every module has a video that is specifically designed for partners. And that makes Hatch at Matilda a really unique product. So we've covered 3 points so far that we want expectant parents like you to know. We started off by saying don't prepare just for the birth, but also for that new phase of your life, which is postpartum and early days with baby. Headshot Matilda takes care of that. The second point we talked about is the birth preferences, wish list, the birth proposal, looking at that in a way with an open mind, a growth mindset, and moving away from the birth plan, and remembering that the Matilda team, they basically will go above and beyond to work with you on that preferences list and to try to make it happen within what is safe and what is possible. And then the third point that we made was the importance of the inclusion of partners. So what is our fourth point? Our fourth point is an important one, and it's actually about, managing what goes on in here so that it affects what goes on in the rest of the body in the kind of the most productive way, so to speak. We're going to talk about mindset. Mindset is so important, and I would like you to think about this in a way. We want you to think about that birth experience and the first few months with your new baby as if it's an endurance event, right? You're going to be thrown into this endurance event. You will have done some preparation, but it's your first event, maybe your second event, but you still won't 100% know exactly what is going to happen. So if you do your preparation without thinking about your mindset, you're going to miss an important piece. And midwife Seng, I know that you feel passionate about this as well. And, if you can share your thoughts on mindset and how you approach it with your clients at Matilda, I would love to hear.
Thank you, Sofie. I cannot agree with you more that this whole birth that from point one, our points have always been interlaying with each other and starting early, and this mindset, preparing them holistically. And as I tell my clients, you have started a marathon and it will take time, right? So be patient, and we will learn some of the skills and tools to help you through it. And one more thing that you have also laid out for the couples at Urban Hatch is mindfulness. And you have gone through some exercises with them, and this is what actually I do with them early on in labor, despite there's no pain. But again, like you said, it's the preparation, the exercise that we really have to start getting them trained in a sense, and practice early on so that they can be better prepared. And I like to, seems long-winded, but like to prepare them again from top to toe and go through the rundown with them again, just to make sure that, again, we're having this communication everybody's on the same page, and goes very well in sync with what Urban Hatch has for them. And I always say, be patient and be positive on that day. And Sofie, would you like to share some of the tips for being positive, and how couples can do it together?
Yeah, and I think what the mindset piece is an important one, and I love that you bring mindfulness into the preparation and the practice on the day as well. So for me, approaching this with a growth mindset, I feel is really important. And this also ties in with the birth preferences and the birth proposal, right? We ultimately know that the guarantee that you get is that you are going to have a baby. So if we make that the goal, immediately the body starts to relax a little bit more, right? Because we've removed a lot of these other targets that maybe we thought about, right? Oh, I want to give birth without pain relief. I want to give birth kneeling on the bed. All of those things, to be honest, they are details that we can think about, we can explore them. But on the day, you may feel completely different from what you had imagined. So the work that I feel is important to do as a couple is to do a little bit of and
seems
to
like
think
we're having
about,
some
this is
lag
what
and
I would
technical
like.
difficulty.
And if I imagine, let me know when I can carry on.
I think we're okay.
Good. So yeah, so let's do some exploring and grab a piece of paper and write down, okay, this is what I would like my birth experience to look like in an ideal world. And I know that in reality, it's probably going to look quite different. When I think about that, how does that make me feel? Does it make me feel tense? Yes. Can I do a little bit of breathing to become comfortable? The fact that the reality of and it's very similar with that experience postnatally. And Seng is an amazing lactation consultant, and having worked with many women over the years in that postpartum period, a topic such as infant feeding, can you think about your ideal scenario? But then also start to think about, what my ideal is going to be possible. Can I become comfortable and okay with that? Because ultimately, breast milk is the most natural form of nutrition for a baby. The process from getting it from the breast into the baby's mouth is a skill that needs to be learned by baby. It needs to be learned by mother. And there needs to be a support system in place as well, right? Because everybody within that family unit needs to be on board with the breastfeeding, and it's not always possible. So what I kind of go on about attached at Matilda is that, okay, breast is the most natural form of nutrition, but it is not the only way to feed a baby. So we want to always think about these things with a more open and more of a growth mindset. There is no failure in labor and birth and postpartum. There is no failure. However, if we make a fixed plan, then we might be more likely to set ourselves up for feeling as if we failed. So let's move away from that.
I totally agree. And
that's mindset, isn't it?
Yeah. Expectations are having that birth proposal is just having a game plan to be a tool and providing you with the methods to resolve issues as they arise, but again, not a fixed plan like Sofie has already entailed, right? And being capable, and you have to believe in yourself. You've been set a great platform with the necessary education foundation, very strong foundation. If you have joined Urban Hatch at Matilda, with the necessary education to make your informed choice for the best of your birth experience, and then the rest you have to go with the flow. And that's what I talk about. Being patient as you have grown this. It took you 40 weeks, 30 some weeks to grow this baby with you. And for that day, birth day is very important, but you have to be patient. You can't expect the baby to come out, crawling out, screaming in a few hours. It wouldn't be beneficial for your body, wouldn't you agree, Sofie? And there are a lot of risks that comes with it. So be patient. And there are a lot of things that you can play with, and we will be with you at Matilda through this journey. And we might take some detours along the way because it wasn't what you wanted exactly how you thought about it, but that's okay. We have enable ourselves with the different necessary skills to resolve it, and we will go through it together. You're not alone. Just speak out loud and be flexible, as we are here with you to bring the best for your baby. And we do have some questions coming in, huh? And I'm gonna read them out loud. Okay, Sofie? We have one from Lee Johnson. Yep. Thank you for the question. First of all, she said, hi, what was the third term Seng mentioned for the medicine aspect of epidural gas? I wasn't aware of the other options. So
Hatch at Matilda talks about all the different options.
Yes. Yes.
So if you lead, that's actually a really good question. And I love that we've got listeners in the group who are making notes of the information. So Hatch at Matilda covers the natural coping strategies, but also the pharmacological coping strategies, the kind of the pain relief options that are available at Matilda Hospital, and like midwife Seng, and maybe Seng, you can just run through them. But if you join Hatch at Matilda, you can find all that information in module 2 of the course.
So just to answer that question, at Matilda there are 3 for the medication aspect of the pain relief. Let's start with the gas, Antenatal, which Hatch easily explain it as 50% of oxygen in Antenatal. Then we have the pethidine, which is morphine-based and anesthesia, but it's given to you IM intramuscularly, and then it will have a peak time when it will work, and it will have a effective time, okay? And then that's one of the options. And then the other option is epidural. This might seem the most common, however, not many moms find it very effective, and it doesn't have to be. A lot of times people think it has to be given early on or at the second stage of labor. Again, we are very flexible to work with you, as in when you would like these pain relief to be given and start in use, okay? I hope that answers your question briefly. We do have another good question coming in. Say, good morning. I want to ask about when should my birth wish list be ready for delivery? Does it apply to all public and private hospitals in Hong Kong? Sofie, maybe I'll start this one off. Having the experience with public hospital and the private now, I can tell you your birth plan will work anywhere you go. It should be respected. Now, there are situations where reality does come into effect. In the public hospital, there are more stringent rules on COVID, especially we're dealing with the worldwide pandemic right now, and they have their own rules that they follow, which are always changing. And I know the last time I was there, when there are different levels of surveillance, we so call it, your partner might not be able to accompany you through labor. But I tell you, at Matilda, your wish for your partner to accompany you through labor is always respected, and we will take our measures to deliver your baby and having your partner here safely under the COVID guidelines. So in that aspect, that is not a problem. That's one of the major issues with public and private. Also, other than that, most of the birth plans should be quite in sync, I think, with the everybody being evidence-based. Would you like to shine in on that?
Yeah, so I think it's a really good question, and I'm going to kind of bring it back to part of your question, which was about when should this birth wish list and preferences list be ready. And you know what, I would go about this as a bit of a process. So if you were to join Hatch at Matilda, you've got this childbirth education course, which you can start at any time during the pregnancy. We would recommend that you start when you're around about 24, 25 weeks into the gestation. However, we have Hatch members who have started much later into the pregnancy as well, and that is fine. It just means that then maybe you may be rushing through the content a little bit. But if you start early, what you can do is go through the modules as we've organized them, and there is a sequence so that you start with the foundation, what does labor entail, what does giving birth entail, and then you move into the natural coping strategies, into the pharmacological forms of pain relief. We then go into interventions, and then the last 3 modules are all about postpartum, immediate postpartum, early days with baby, and infant feeding. So if you were to start educating yourself when you're around about 24, 25 weeks pregnant, and your partner, you will then automatically start thinking about your birth preferences, because in the course, I always come back to that. So it will start a little bit of a thought process, and then we would recommend that by around about 34, 35, 36, 37 weeks, you can then start writing things down in your birth preferences list. And Hatch and Matilda includes a template that you can download and that you can use as a tool to do your personal one. So that's I would approach it not as at 35 weeks I need to sit down for an hour and do this. You want it to be a process that starts as you start your Hatch at Matilda learning. Did that answer your question?
Yeah, I think so. Again, wrapping up, start early, but don't be definitive, and then revisit it toward 30-some weeks. And then again, we will review with you at Matilda. We do have another good question coming in from Valerie. Thank you. She said, does choosing semi-private versus private at Matilda limits our involvement with birth partner and father can be involved? For example, being bathing the baby. Whatever class you have chosen, your care will not be differentiated in that aspect, in delivery, in your baby care. So I assure you that part will be the same.
Which is fantastic.
Do we have more questions coming up?
Do we have more questions?
We have from Peg, any advice on speedy recovery after giving birth? And we have another one from Deborah. Please explain the benefit of collecting the cord blood and stem cell storage services? What happens once collected, and where and how it's stored? Let me tackle on this first, Sofie, and then I'll feel free to chime in if you have any suggestions. For speedy recovery for after giving birth, whether it is natural delivery or your section operation wise, I think Sofie would agree with me. Returning to natural, normal life and believing in yourself and taking good care of yourself is the best way. Certainly, as a lactation consultant, I would say that breastfeeding is helpful, but nonetheless, if you have chosen other means of feeding, doing skin to skin, having also initiates a lot of the hormonal effect, and which will help with recovery. And for Deborah, the question about cord collection, there are a few choices here for the cord stem cell saving company. So you first need to choose it. Maybe you would like to talk that out a little bit more with your doctor, because it's not fair for me to sell any particular company. We do have that kind of service, and as to the quality, the storage, where they do that, you can then ask into the individual companies. And then what we do here for you is that you let us know the choice of company you have chosen, and then we will work with the doctor to save the stem cells for the baby. And you have the choice. Usually they offer the choice of cord blood, the cord itself, and then some actually offer placenta as well. And then you will call the company and they would come and collect it for you, and they will from there do their storage. But for details, please inquire about it from different companies. Sofie, would you like to take on that question about recovery?
Yeah, so I think on the speedy recovery pack, it's a really good question, and thank you for thinking already about recovery. So I would like everyone to reframe speedy recovery to a solid and safe recovery. So we're going to forget about focusing on speed, and we're going to focus on a solid recovery foundation. And that recovery really needs a few things. It needs that focus on mindfulness again, which isn't easy when you're just a new parent, but it can be done, and we talk in Hatch and Matilda at length about that.
Yes.
Then there's movement involved as well, and rehabilitation of the parts of your body that have come under stress. So after a vaginal birth, it would be your perineum that may need a little bit of rehab. And after an abdominal birth, it's going to be that abdomen and that whole core structure that will need some extra TLC. Then the other part is really important, and that is the nutrition piece. So after giving birth, we would like you to focus on making sure that you've got your macronutrients right. So we want obviously carbohydrates, we want healthy fats for that wound healing and that healing of the musculature, and we also want protein. So we actually, I mean, we could spend a whole hour on this, which we don't have time for, but Hatch at Matilda does talk about nutrition as part of that solid recovery. So Peg, move away from focusing on a speedy recovery and think about, okay, what do I need? What are the foundation pieces for me to actually recover solidly? And then layering onto that, what midwife Seng said as well, we want you to kind of, you know, move normally in a way that feels good and that is comfortable. And I think that's all I wanted to say on that piece.
Yeah.
Fantastic questions, actually.
We have a very attentive audience here, and time is short. So one last question, okay? Quick question. If anybody else have more questions, feel free to email us and call us at Matilda. But here it goes, last question from Lee. I have some questions regarding the logistics. However, one thing I learned has been that if the child comes from a mixed race background, it can be much more difficult to obtain a match for the collection. Okay. I'm sorry, Lee, I have to be honest. Regarding the obtaining a match, I'm not too sure about the collection court aspect that the specifics that you're talking about. Maybe you would like to call us or inquire more personally. I think I would like to take this time to wrap up. Thank you for being here, Sofie. It is our pleasure to work with Urban Hatch, and I believe you have created a very strong foundation for all our expectant parents. And remember, parents, we are here with you, and there are a lot more resources that you can obtain from Matilda when you signed up with us. We really hope that your experience here with at Matilda and Urban Hatch will be pleasant, and you will for sure obtain a comprehensive and holistic care to the best of our abilities. And I hope that you'll have a pleasant stay at Matilda. Sofie?
Yeah, thank you so much, Seng, for having me today. And thank you everybody for joining this Facebook Live and learning more about the 4 things that you need to know as an expectant parent. And I think this video will stay on the Matilda Facebook page, so you can always refer back to it. And then, of course, we would love to see you at Hatch at Matilda and give you that guidance and that education that you need to prepare, not just for the birth, but also for that new phase of life that you're going to be entering. Be well, take care, and I look forward to seeing you soon.
Thank you again for Sofie's joining us today, and thank you, audience, whoever is joining us today. Thank you. Have a great day.
Take care. Bye, Seng. See you soon.
Bye.